Would you like to give us some history about midwives in New South Wales and how they've contributed to the standing of midwives in New South Wales today?
Okay. Well, all the early midwives were, most of them were untrained in the first instance, and but by the early part of, say, the 1900s, most midwives, whether they're here in Sydney or in country towns, were becoming trained, and they would be trained, and if not trained, they would associate themselves with the Australasian Trained Nurses Association. And most of them were interested in some kind of professionalisation, increasing their training. And just about every country town in New South Wales had 30, 40, sometimes more midwives. That often they were sisters, were working together, or indeed they were friends. They set up a hospital together. And it could be anything from just 2 beds to 4 beds to 5 beds. And these hospitals in country towns were really became the community centres for most women. It was, in fact, women's business, and a good business for the women who went into it. My great-grandmother, Mary Kirkpatrick, she was the first midwife to establish a maternity hospital in Kempsey on the mid-north coast in the late 1890s. And she went on to establish 4 hospitals altogether, some of them quite large, although, like a lot of midwives, although it was a good business, she didn't necessarily make a lot of money, and most of the places she did have were rented. From there, I began to look at all of the towns along the mid-north coast, from the Willamar down to Port Macquarie, and discovered that places like Grafton, Lismore, Kyogle, Casino would have anything between 30 and 40 midwives. And I've collected 600 biographies and something like 180 private maternity hospitals. These women were all trained in Sydney. They were professionals. Almost every one of them were interested in developing some kind of a professional image. They worked with local doctors. They wanted to provide an image of themselves that was more than just that old style Saree Gamp, but it would, as it was often known. And they were very anxious to have that kind of respectable, professional front. And I know my great-grandma, I found something like 5 photographs of her in the local museum, and every one of them, bar one, she's in her uniform, with a baby. That she delivered. So, and they were very anxious to have that professionalisation developed. Most of them trained at the Women's Hospital here in Sydney, or the Royal, or indeed the Home Training and Lying In Hospital, which was run by Louisa Ardell. And I did notice that in my look at some of the country towns, and indeed in Sydney, that if someone had trained at a particular hospital, you'd often find that in that country town or in that particular hospital, that's where they were all trained. They would often recruit each other from a particular hospital in Sydney. And also, I think they contributed quite a lot to very safe childbirth in country towns. In that period, from about 1900 up to 1940, when the midwives began to kind of peter out, public hospitals were beginning to make their mark. But most women did not choose to go to a public hospital, or indeed any kind of hospital to be confined. They chose a midwife and her private maternity hospital. And in my reading of the literature, they had a much better mortality rate than did the public hospitals. If I just go on my own great-grandma alone, she had a great reputation for scrupulous cleanliness. She scrubbed and she boiled, as they did in those days, by trying to make sure that everything was scrupulously clean. And the other thing that they did that I think which was important for communities, apart from linking into their communities, they worked a long time. Most of them were still working into their 70s. They would take so that they then passed on all of that wonderful experience, both in terms of their business acumen and also their nursing expertise, onto younger women who they then worked as colleagues with. So they were very collegial as well, and I think they contributed to the health and safety and better healthcare of women in country towns.